If you look at the AP of this lady, you can see there is an obvious loss of joint space here. It looks abnormal, so this is translated laterally, and if I show you the lateral view, it shows a clear dorsal dislocation of the proximal interphalangeal joint. Now, how to reduce it? Now, there are two ways that most people will do. One will be to apply a longitudinal traction, but I try to refrain from applying longitudinal traction because sometimes it can convert a simple dislocation into a complex dislocation. That means soft tissue interposition in the volar plate which is not there. If you just give a longitudinal traction across this line, it can convert them into a complex dislocation. So what I do is, if I try an arrow here, I would push this back with my hand, and then with other hand I will try to reduce it, and I will explain it again when I am doing the reduction maneuver. So I have just drawn this for you. This is P2, this is P3, there is a volar, and this is how the dislocation is. So what I'm going to do is, I'm going to use my thumb here to push this back, and with the other hand I will reduce it rather than just pulling it. So I will demonstrate it again when I'm reducing it. So my thumb will apply this force, and with the other hand I am just going to pull it and reduce it back to its original position. So what I'm going to do is, I am not pulling like this, because if you are lucky you may reduce it. If not, then you can make it a simple dislocation to convert into a complex dislocation. Don't just longitudinally pull it. So what I'm going to do is, we have already given some ring blocks so that she doesn't experience pain. With my thumb I am pushing head of the proximal phalanx, so I'm just pushing the head back, and with other hand I'm just going to apply longitudinal traction and then reduce it, and this is all done. So you can see hand is working properly. She can start moving this normally. So you can see now this is bending completely. She is moving the hand quite normally, and the pain is much better. So my message is that don't give longitudinal traction. So push this, push the head back, and the other hand reduce it. You will hear a click, and then your reduction will be much easier. So she can make a fist. So this is how you reduce a dislocated proximal interphalangeal joint of a finger. So once you have reduced the fracture dislocation, it's mandatory that you take a check x-ray, make sure that you have managed to reduce it properly and your reduction is proper. So if you see here, it looks pretty good, and here it looks pretty good. So after you are happy, then how to apply body strapping for around 3 weeks, but you can get the patient moving her hand pretty much straight away after the reduction. So this is the same lady we have applied the body strapping, but she can start moving the hand pretty much straight away, and a pain or symptoms are almost completely clear.